Morning, Dr. Jaffe. Thank you for being with us. This question comes from a doctor who is new to recommending the C cleanse to his patients. He writes in saying, if they were related, can you present the possible reasons why a patient experienced a severe panic attack 2 hours after finishing their first C cleanse? Do you have any recommendations on what to do to prevent this from happening the next time the patient does a C cleanse?
I appreciate the question. The question is there a link between doing a C cleanse, maybe the first C cleanse the individual has done, and a panic attack a few hours later? Let me make some assumptions and then I'll give you the answer based on my assumptions. My assumption includes the fact that this person has had panic attacks before. It was not the first panic attack. If you look at the tens of thousands, maybe now hundreds of thousands of people who have done the C cleanse for the first time, the number of reports, and we do ask our colleagues to report anything of concern, anything of adversity, is zero. So I think that coincidences deserve to be respected. I'm pretty sure that this person doesn't yet do abdominal breathing for 5 minutes twice a day, use a green dichromatic light for 20 minutes twice a day, do active meditation for 15 minutes, evoking your healing response and your relaxation response. I'm pretty sure the person doesn't yet do that, because unless you have been following guidance like ours, and I learned this from others, but I do guide others now in this, what I would recommend is that the person start 5 minutes of abdominal breathing twice a day, that they include 15 minutes of active meditation or relaxation response a day, twice a day. While they're under the green dichromatic light, you get multiple benefits in a short 20-minute interval twice a day. And then if the colleague wants, we can talk about what might be triggering the psychophysiologic response called a panic attack. The psychophysical, so there's a mental and a physical component to a panic attack. We know that ascorbate reduces excitoneurotoxins. That reduces the chance of a panic attack. We know that ascorbate sets the redox potential, and that reduces the electrical excitability that predisposes to a panic attack. We know that when you look at functional MRIs of people who have done C cleanses, that those people have a neurochemical pattern in the brain that says calm and not anxious. So, interesting case, we always trust the person, the client, the consumer. This person clearly had an adverse experience that I think was only coincidentally related to the C cleanse. I can imagine why a C cleanse in a person who is predisposed to panic could, a few hours later, evoke a physiological or psychophysical response that would evolve into a panic attack. Although I would suggest that is really coincidental and not causally related. So if panic attacks were provoked in any, if panic attacks were evoked by the PERC C cleanse, we would hear about it. We deal with the most sensitive people immunologically, neurochemically, hormonally, environmentally, personality-wise. And we have always urged our colleagues, those we mentor, those we serve, we have always urged them, if there's anything of concern, contact us. But I will mention that in the 35 plus years that PERC has provided the PERC Potent C Guard and the C Cleanse recommendations, we have never filed an adverse event report with the Food and Drug Administration because there has never been a link between the C cleanse and an adverse event, including a panic attack. And I'm glad to tell you that we're one of the few companies that has not filed an adverse event report with the FDA, because millions of them get filed every year. You don't have to have proof of harm, you just have to have suspicion of coincidence and connection. And I'm glad to tell you, we do not hear of panic attacks being provoked by the C-clans. And so for this individual, I would focus on them, what I recommended to help them rebalance their neurochemistry and their hormones. And then the panic attacks might just go away on their own.